Today we had a conversation about a number of issues, the intersection of public safety, of encampments, and about homelessness and solutions for that. This conversation right now, as I understand it, is specifically about a field trip, if you will, that many of our panelists and others in the community, in the courts, at the state level, at the city and business interests, looked at a model in Miami where they are effectively, and have been for 20 years, effectively diverting individuals with mental health issues into appropriate venues of care instead of incarceration, instead of venues that simply exacerbate those individuals' situation and do not solve for that. So with that overly brief introduction, I'm going to let our panelists today introduce themselves and talk to you about what they saw, what they learned, and what we hope to achieve in this community to improve our response for people with mental illness and for those who need shelter and services in our community.
Erin, yours. Okay. I'm Erin Litvak. I'm the Deputy Mayor for Salt Lake County. I think our Miami trip was eye-opening from a community-wide standpoint, looking at all of the systems that typically work in sort of a siloed manner. We have our criminal justice system, we have our homelessness system, we have our behavioral health system, we have our law enforcement systems. And one of the best opportunities that came out of Miami is really getting to understand from everyone's perspective what the issues are, what the gaps are. But the most unifying thing, I think, from our trip in Miami was that we all collectively were aligned on wanting to improve our systems to help those in our community who are suffering from homelessness, mental health issues, and substance abuse issues. And I think we're all committed to a better system overall and a more collaborative system amongst each other to improve the outcomes for those individuals.
Hi everyone, my name is Sim Gill. I'm the Salt Lake County District Attorney, and I'm also the Salt Lake City Prosecutor through an interlocal agreement. And to put it in proper context, actually, this was our second trip because Mayor Mendenhall and myself and Mayor Wilson, we had all gotten together about a year ago, and we started to focus on the issue of high utilizers, those individuals who were intersecting with the criminal justice system in our community that were causing these disturbances, these issues that were happening. And we started to look at this population, and we took something internally from studying that, which was that we had siloed our responses. We were spending a lot of resources. This is an ongoing issue that had repeated itself before. So we sent a small group of people to Miami-Dade at that time. They went there, they came back. Subsequent to that, I approached Mayor Mendenhall. I said, this is an opportunity for us to actually take leadership there because, and if we can witness the same thing collectively, then we know what to depart from and what to build upon, and their data was compelling. Now, Utah has a great history, and certainly in the intersection of criminal justice and behavioral health, to look at a treatment-based model, right? I helped start the very first mental health court 21 years ago, which has demonstrated incredible success. We invest in therapeutic justice models when it comes to drug courts and veteran courts and treatment courts. We have in Salt Lake County a remarkable behavioral health system. And so, but we have this ongoing issue. So what was remarkable for me was that Miami-Dade has taken some of the principles that we already have in place, that we have intuitively and institutionally implemented, but built a cohesive response, a community response, which is collaborative across the continuum of stakeholders. right? From everything from the business community to the behavioral health and resource community to the intersection with the criminal justice system, the jail system, all of us. They all play a collaborative role. And the net result of which is that there is greater continuity of care, there is great humane interaction that is actually getting services that people need. There is not a repetition of wasting of dollars, which we are still spending. Whether we adopt a comprehensive model, a collaborative model or not, we are still going to have to respond institutionally. And those dollars are being spent. But the return on investment of those dollars is minuscule comparative to what we hope to achieve. So getting out of our silos, recognizing the interdependentness that we have with each other, and recognizing that as a public prosecutor, the jail and the prosecution is not the solution to this issue. Mental health is a public health issue, right? Transitional housing and deeply affordable housing are political solutions that cannot be substituted by criminal prosecution alone. Unfortunately, we have looked to the criminal justice system to be our crisis managers, and what we have learned is that we will never be able to arrest our way out of this situation. What we've learned is that this criminal justice response is the wrong response in terms of systemic long-term gains that we want to make. We validated that with some of our therapeutic justice models, and this trip with the partners that we went there comprehensively revalidated that, and to me, left with a very strong impression that we can make an impact, and we can make an impact that is substantive and systemic and sustainable.
I'm Erin Mendenhall, Salt Lake City Mayor, and what you're seeing hasn't happened before. I want to give a general context that as a state, really as a county system, about 5 or 6 years ago, we took a step back collectively in reimagining homeless resource centers by eliminating the single collection point of the road home downtown as it was, which would exceed 1,100 people on some winter nights, and decided to focus in more distinctly on certain populations, women, men, and couples. And the family shelter existed before that. What you're seeing is a drilling down into the acute needs of specific parts of the population who experience homelessness in Salt Lake County. And actually, for the first time, a focus across levels of government and service provision on the hardest to reach and the hardest to serve part of the population. I would characterize it as the high needs and high impact, which is the vast minority of the total population that experiences homelessness. The majority of the population who experience homelessness in Salt Lake County, and even in the state of Utah, resolve that experience in short term, and they return to stable housing, not to come back into the system again. But there is this very small portion of the chronically homeless population who also intersect with mental health and often behavioral health needs. These individuals with these highest needs create the highest impact in terms of quality of life and community impact in areas like downtown, but certainly not isolated to it. This has been really an untouched conversation up until about the last year. And I am incredibly grateful for not only the partnership, but the shared focus and responsibility that I think all of these organizations and more who participated in the exploration are stepping up to say, we can do this, we are absolutely capable of doing this, and we very much want to do this. It's right for those individuals and the needs they have, it's right for our broader community, and it's right for our taxpayers. Because what we saw in the data that proved out in Miami over the last 22 years is that they are spending a fraction of the cost on serving these high needs and high impact individuals in the right way by providing stable housing, case management, and access to medical and behavioral mental health care needs than they were, as we are today, trying to run them through a criminal justice system that does not serve them. And so we have a model. There are other models similar to it across the country, but this coalition that's coming together has a model that we're beginning to pursue here locally, and I'm incredibly heartened by the opportunity that we are seizing here together and our ability as Utahns to do it even in a faster way than Miami-Dade County has been able to put together.
Wayne Niederhauser, the State Homelessness Coordinator. I was in Miami to represent the state and how the state can support our local communities in responding to this very difficult situation in our society, and that's homelessness. My takeaways from our experience in Miami was the ability that Miami has been, the ability they've had to break down these silos. It's coordination. Coordination is going to be key to anything that we do and how we go forward. And it was very interesting to me. It was led by the judicial system. That was very curious to me. There's a judge there who's very passionate and had led a lot of the reforms in Miami. And I'm not saying that's where it should start here. I think we all need to come together. And to think that law enforcement won't be part of the solution in the future, no, they're going to continue to be. But how we respond and how law enforcement responds and where people go, that's going to change and the system will work better.
Good afternoon. Mike Brown, Chief of Police in Salt Lake City. I've said, I don't know how many times over the last several years, that mental health issues are not a crime. Being homeless is not a crime. Yet, what do? When there are issues and concerns in our community, we call the police. And we don't have a lot of tools on our belt. And so what we do is we make an arrest and we take them to jail. We think that is going to fix the problem. And yet we find over and over and over, it's just a revolving door where they come back to the street. It's not the help they need. And what was so refreshing and what I really took away from our trip to Miami is, number one, the leadership that is behind this. Mayor Mendenhall, thank you for your help. President, thank you. Sim, Erin Litvak, Sheriff. Like you said, Mayor, this has never happened before. I've done this for 31 years, and we've never had this kind of energy and this type of leadership pushing this issue. So I'm really, really excited that we are going to have compassionate, empathetic ways that we can help and treat those that we deal with on the street, because we need that. We continually do the same thing over and over, and we expect different results, and it doesn't happen. So I'm excited for where we're going and what the future brings.
Hi, I'm Sheriff Rosie Rivera, and I'm happy to be here this afternoon. I think this Miami trip was really important because it brought the right people together to have the right conversations. So I know for law enforcement, we have been for years saying that we cannot incarcerate our way out of this problem. And it felt like we were on an island by ourselves. And now we're not. We are collaborating with all folks who have a part in this and can help us solve and move forward with what we need to do, not just with our homeless population, but those who do suffer from mental health issues and substance abuse disorders. Those all have to be addressed, but we can't do it by being an individual or an individual elected. It has to be, we have to collaborate together. And I think that the Miami trip showed that if you do collaborate together, your outcomes are going to be better. And so I'm really happy about, everybody here agreeing to work together to help combat this issue. But also at the same time, not everybody is in this room. It's going to take a lot more, and it does take funding. So that is another important piece.
Questions?
I'll just volunteer that one of our next steps, my office said yes to working with an entity that nationally can come in and help us do a system mapping of what exists today. For example, take a couple of actual cases of individuals who are these high needs and high impact, who are most frequently running through all of our systems and others, and that we will analyze the system as it exists today, where those silos are, simply where the system was never even designed to serve these needs and this population. And the next step after that system mapping will really inform how each of our levels, and as Sheriff said, beyond, we had Department of Health and Human Services on the trip with us as well, representatives from Huntsman Mental Health, and others from the state, county, and city as well.
I know you guys kind of touched on this, but a lot of people might think that Miami is not similar to Salt Lake City at all. Could you kind of talk about the ways in which our homeless population and what they're doing there are similar?
Sure. I think others may have a start, but I've never looked to Florida for political answers in my life. But these, Judge Leifman is the individual who, the justice we talked about, who really started this program and has been leading it for about 22 years. We spent a couple days learning from him and from many others who kind of represent our similar parallel organizations. And when it comes down to it, it really doesn't matter the politics. This is about human beings with complex needs who have histories of need that have been unmet or exacerbated by the systems that exist. And it's also about a waste of taxpayer dollars as the systems continue to cycle people through without resolving much of anything, and sometimes making it worse. So that part is human nature for us to address, that people have serious needs that are being unmet, and the costs are being shouldered broadly across the state of Utah, but also locally by residents and businesses who don't have the means to support them on their own.
Things that contribute, though, to homelessness are pretty similar worldwide, actually. And, it's based in trauma, just some behavioral and mental health issues. And to think that they're different, yeah, well, I mean, the climate's different. It's a different location, but the situation is pretty much the same.
I was going to say, I had the privilege of working with Judge Leifman over the last 2 years with the Center for State Courts, and we've been working on, and in fact they just published it, which is a blueprint, national blueprint to go to all courts in the country about how to institutionally respond to this population, which is mentally ill and intersects with the state system. That report from the Center for State Courts got published 2 weeks ago. And through that experience, one of the things that makes it similar is that every community in this country, it has criminalized mental illness, has criminalized poverty. And people who are poor and people who are mentally ill, often the criminal action is a consequence of their situation. We have taken what are public health issues and social issues and criminalized them. And so we, in every country, in every, county and every different state, we are responding with the criminal justice system as the crisis manager. And what Judge Leifman has demonstrated, and what we have demonstrated also in Utah, is that therapeutic justice and diversion of and deflection of these populations and pushing them back into community-based resources and going to, as Wayne said, the root causes of it. Whether it's economic issues, whether it's institutional issues, are a better return on investment for us. So what we're doing is we're shifting the paradigm from law enforcement and prosecution and our criminal justice system responding to this, to a more social services, community-based model, which is data-driven and research-based, so we can have better outcomes. But that is building that infrastructure, and that's why I really commend Mayor Mendenhall. She and I talked about it. I've been a public prosecutor for 27 years. I know at least 12 to 14 times over my career where we've had a convening on this issue. And we do the same thing. And when I approached Mayor Mendenhall, I said, we've got to do something different. And she demonstrated the leadership to want to do something different. And this is that paradigm shifting. It's a paradigm shifting from a law enforcement response to a community response and resiliency and infrastructure building that has been long, critical, and overdue. And that's something every community is struggling with.
Can you provide an update on the winter overflow shelter?
I can do that since the state's the lead organization. So there was a process over the summer that with mayors, the result of that was 100 beds of additional overflow on 33rd South in Millcreek at that's the library. Can't remember the name of the library, Smith Library. And that was opened up. It's been opened up for almost a month now, and taking folks in there, and been running about 50%, 75% capacity, which we thought was kind of interesting. Although, you know, we had a fairly warm November. And well, it'll be interesting to see what the results are now that we enter into a cold and wetter part of the winter. We did flex the resource centers, 175 beds there. And then we have the St. Vincent's that does 65. The result is about 340 overflow beds for the winter. And they are now all open. And again, the data to this point is that we're not running at full capacity, but we have the capacity, hopefully, to address those who need to come or want to come into shelter during the winter. At least we're thinking that there'll be more demand for that as it gets wetter and colder.
I want to take that opportunity on the number of beds that are necessary to just contextualize how unique Utah and even Salt Lake County specifically is in the West, in the number of people that we're talking about who are unsheltered and don't fit into the system during the summer months, and more acutely, the portion of the unsheltered population who have that confluence of mental health, behavioral health, and substance abuse disorder, who are cycling through a criminal justice system approach that was never built to do this. We have so few people relative to our neighboring states and many, many, many other parts of the country that this is absolutely something we can take on, but we can only do it collectively. I think you keep hearing that again and again. We need each other. No single entity is either wholly responsible or wholly able to solve it. And I think just the sheer number of people we're talking about providing a better service path for and saving the financial savings therein is incredibly hopeful for us.
Mayor Mendenhall, you mentioned next steps. Is there more urgency now to get this off the ground than it is winter? And we've seen sustained cool temperatures, get people inside, and provide people support with mental health crises?
It is completely urgent, but I think we all feel that. And the behavioral and mental health services is a county function, which I know they are providing intersections with the shelters that are operating for people to access those services. We also provide the access collectively on-street outreach efforts that happen, as well as the VOA, which the city funds to go out and do that on-street intervention and access to services. But this is a systems approach, and Judge Leifman said to us it was a 22-year overnight success. I think we all came away believing that we have many more of the tools already than Miami did 22 years ago, and that we have the momentum across organizations to put this together with some expediency. But this is a seismic shift in the systems that we really have never seen before. Even restructuring the Homeless Resource Center system is a 10,000-foot view compared to this ground level, human by human specific triaging that we have never quite done before. So it will take some time, and the system mapping will be our first literal map of how far we are from implementing.
Is there a rough timetable in place right now to when we'll see some changes?
We are reconvening before year's end. I think we have a date in about 15 days coming together. And my office is coordinating to get that national system mapping organization out here, hopefully in the first quarter of next year.
I have a question. A sentiment has been kind of repeated that incarceration and prosecution is not a solution for homelessness. But in speaking to some of those who are experiencing homelessness, they kind of have expressed that they commit some petty crimes or crimes themselves to kind of move out of that situation where they have a roof over their head, they have 3 meals a day, that kind of situation. Is this system going to absolve those who kind of turn to that kind of attempt, or what do you anticipate with that situation?
Well, first of all, think about what a sad situation is when we have people committing crimes to actually get access to services, which should be a human right, and out of compassion and kindness, everyone deserves, right? That reminds me of the same thing when I had a mother who called me up and said, "Sim, can you tell me which crimes my son needs to commit, which felonies, so I can get him into mental health court, because that's the only place where we can get affordable medical support." So there may be some people who may, because of the systemic response, they're efficient, they may have done that. But it's a much more difficult and sad situation. So one of the things is, if they are homeless or if they are mentally ill, the criminal justice system should not be the pathway. So there should be, through the ambassadors program, community outreach, funding of community-based organizations, off-ramps for those people to have access to services. The second group is that individual that actually is acutely mentally ill, and their mental illness creates the consequence of criminal activity which we have criminalized. And they're cycling through. And again, that should not be the place where they need to be. If you're acutely mentally ill, the last place you need to be is sitting in a jail cell and not having access, and even as we try to get you access to temporary medications, which take 3-4 weeks to even take effect, right? So the goal here is that nobody who has a public health issue or a personal health issue or mental health issues, or out of whatever circumstances finds themselves homeless, looks to our criminal justice system as the answer. Over the last 27 years, I have a hypothesis. When public policy makers fail to address the issue of economic justice, political justice, social justice, public health, those public policy deficits manifest themselves as crises in our community. And then historically, we have looked to our law enforcement to be our crisis managers. And that is not a viable solution. And what we are, I think, all sharing with you is that long-term, that paradigm shift is long overdue. It's backed by data, it's backed by research, and we cannot afford economically or on a human level to continue to look to our criminal justice system to try to address public policy deficits. We have to talk to each other, we have to communicate, and here's the irony. It is a cheaper model. It gives you better outcomes than a criminal justice response, which is the most expensive, the most dehumanizing response, and the most discompassionate response as a community we can do. So I'm excited about this.
Can I just add just a quick point? Back in 2016, we opened the Community Connection Center. That's where we introduced social workers into law enforcement for that very issue. I mean, there are situations where the power of an arrest, not that cops aren't compassionate and empathetic people, there are social workers that can help individuals just like you described connect those dots. Because jail is just a temporary fix. It may just a place to warm up and get a meal. But what is the real issue? And under Mayor Mendenhall's leadership, we've doubled our social worker team. And so if you listen to our radio channel, you'll hear officers out on calls, and they'll be calling for our co-responder officers and our social workers to come. to help address those issues, to find somebody, maybe some temporary housing, maybe they need transportation, maybe they just need a meal, but for those very issues. That's why we've really taken social workers to a new level within the Salt Lake City Police Department, and it's really helping us serve our community much better.
But it's worth noting that our approach through social workers, the jails approach, and the behavioral health, mental health intersection that can happen there, these are all very temporary little funnels. I mean, people don't, 100% of people who are in the jail end up back in our communities. Sim cited earlier, 98% of people in the prison come back into your community. So where are they going? Because we can invent social workers all day long. They can invent better resources in the jail, but it's so temporary. And what Sim really well articulated about the frustration and sort of the idiocy of the system as it is today, this is national. This was not created by any level of local government or even our state legislature. These are federal policies that have been playing out really since the early 80s when the mental health hospital system evaporated. And that these systems were never directed or coordinated to weave the net back together. So that's left people like us searching the nation for where at a local level they have built the net themselves. And it's actually one of the most exciting policy endeavors that I've had a part in the 9 years I've been in City Hall.
And I think when you hear the work that we're contemplating and what we're talking about, there's a number of layers of intercepts in the community where we can look to divert people to appropriate services. And in addition to the city's program, there's a county-wide program called the medical, it's called MCOT. It's the Medical Crisis Outreach Teams that can co-respond with law enforcement to help calm a situation and divert people to services. Again, it's the whole avoidance that Sim spoke to about avoiding bringing someone into the criminal justice system, which can re-traumatize them. It's really looking to find the right fixes for people at the right times before we even get into the criminal justice system.